One term you are likely hearing a lot about to help deal with the coronavirus is what is known as flattening the curve. Epidemiologists say if not enough protective measures are taken, there will be a sharply rising number of cases, as shown in this pale blue spike, a huge jump over a very short period of time. That would strain the capacity of our health system. But flattening the curve, reflected by the lower gray swell, is achieved by taking strong measures like physical and social distancing to make sure the number of cases increases more gradually. Dr. Asaf Bitton has been talking about this very issue. He is with Brigham and Women's Hospital in Boston, and he joins us now. Dr. Bitton, between Washington and the states, are the American people now being given enough guidance to induce them to do the right things?
I think that we're starting to be given that guidance, but we really need to urgently increase the pace of coordination and of stringency in the response. As you mentioned, the curve that you're talking about, the trajectories that we're seeing are not sustainable for our health system to manage. We simply do not have enough beds or ventilators to manage a moderate or severe outbreak like this. So we have to stretch out the number of cases and prevent the number of cases from flooding the hospitals now.
So just to clarify, we're not saying that people aren't going to get this virus. A lot of people will get it. The goal is not to have so many of them get it at the same time, which would overwhelm the capacity of our healthcare system. Is that right?
Correct. The issue is really about the speed and growth of cases, of people that get it, and the severity of cases that would overwhelm particularly our acute hospital and ICU systems response capacity.
I'm asking because I think some people think maybe I can avoid this altogether. I mean, the fact is many Americans will get the coronavirus. Is that correct?
Unfortunately, it appears to be so. This is an incredibly transmissible infection. It has a high reproduction rate. It has a high infection rate. A lot of those cases might be mild, but a lot will be severe, especially for folks in high risk.
And so Americans should be, as we've been saying, they should be distancing themselves. They should be staying at home. What do you say, though, to those people who say, I really need to, for example, continue whatever work I can continue? I need to get out because my family's depending on me.
These are going to be some of the really difficult choices that we all face moving ahead. On the one hand, right now, these seem, for some people, a voluntary choice. We're seeing that some people are working from home. Some companies are trying to have their workers work from home. But increasingly, as we just saw today in San Francisco, and we'll see in other states, there will be involuntary measures that will really start to close down and distance people from each other physically. So while people who work perhaps in non-essential services may want to continue that work, and I'm very sympathetic to it, unfortunately, the speed of the rise of this epidemic may make necessary more involuntary closures or restrictions.
Dr. Bitton, a lot of people are asking, I think, a question that's impossible to answer probably, but how long is this going to last? How do you answer that?
It's a hard question, but it's one that we need to start grappling with. And what I would say is this looks to be many weeks to months. It's hard to imagine that there's evidence from other countries that we can control this within just a week or two. So I think we need to prepare for this to be an extended time where we're socially distanced. It's really hard to predict the dynamics of any particular epidemic, but this one is almost unprecedented. And I think it's really important that we all have a new social compact around coming together by staying apart.
And just quickly, finally, to those who are concerned about whether there are enough hospital beds, enough ventilators for those who are the most seriously ill, what do you say?
Well, we have, according to the American Hospital Association a couple of years ago, we have a little over 900,000 beds. We have about 50,000 medical ICU beds that are staffed and another 50,000 other type of ICU beds that are staffed. And in total, about 160,000 vents. What that means is even in a moderate scenario, like predicted by the Johns Hopkins Center for Health Security, if it all came at once, we wouldn't really have the capacity. That would overwhelm that existing capacity. So what's needed now is for people to take the community mitigation and social distancing strategies to flatten the curve, to spread that out, so that if those cases do emerge, and it's hard to predict, but it's possible at this point, it at least can emerge over an increased amount of time. Otherwise, this is going to be very difficult on our health system and our healthcare workers.
Dr. Asaf Bitton, thank you very much. We appreciate it.
Thank you.